With a growing number of young people reporting severe depression, parents and pediatricians are being encouraged more than ever to recognize the symptoms.
We've got clinical professor of pediatrics at University of Washington School of Medicine, Dr. Don Schifrin, back with us to talk about how pediatricians can play a role in helping to diagnose teens with depression. Just this week or last week, the American Academy of Pediatrics came out with some guidelines encouraging pediatricians to take time out of their annual appointment with those kids to talk about depression. What's your opinion on that? And do you think that pediatricians are able to incorporate this into their checkup?
That's a great question. The American Academy of Pediatrics published this 10 years ago. This is an update to that, where they encouraged to watch for signs and symptoms of depression in teenagers that come in for a sports physical or for any reason. But they've updated the guidelines for looking at adolescent depression in primary care, not just pediatricians, but also family practitioners. This is statistically a very big part of adolescence. Adolescence is stressful enough, as you know, hormonally, psychologically, physically, very stressful, and a lot of environmental, school, social media, etc., can lead to depressive symptoms that are misdiagnosed and sometimes missed. So the universal screening for these youngsters is very important. And again, parents should notice changes in the youngsters' presentations at home. Are they irritable? Is their appetite changed? Is their sleeping patterns change? All those things can be noticeable, and it's up to parents to actually bring that to the attention of the pediatrician. But because that's often missed or misunderstood, as other symptoms can be, the pediatricians and primary care practitioners are now encouraged significantly by the American Academy of Pediatrics to use screening purposefully for adolescents.
There's just so much. There's so much going on in high school. I know that you can't put your finger on one thing, but is there one sort of trend that you're seeing among children, kids, teens, that is sparking this kind of depressive behavior, depression?
Well, depression can occur on a genetic basis, but also there's so many social stresses on kids right now. And then if you throw in the LGBTQ community, which is, again, a very big stressor to produce depressive symptoms in adolescents who are struggling with their identities. Again, the statistics now, 1 in 5 to 1 in 8 adolescents have symptoms of at least mild to moderate depression that are missed. And again, it's up to parents to be supportive and really communication with your youngster, listening, acknowledging their feelings, being supportive, and again, transmitting that information to the pediatrician or primary care practitioner.
As a parent of a teenager, though, sometimes it's hard to determine what's just simply a moody teenager going through difficult teen years and what is enough of it to be a concern to bring up to the pediatrician. So what are the things that parents should keep in mind, sort of the red flags, if you will, to say, you know what, maybe I should call my doctor, pediatrician, somebody for help?
Again, a great question, because teenagers are normally pretty moody. Any parent of teenager would acknowledge that, sometimes a little cranky. And again, it's a deviation from the norm. Have they been withdrawn? Is their school performance going down? Have they not been out with their friends? Do they not want to venture out? Have they become sluggish? Do they not want to get out of bed and participate in normal family activities? Noticing that change will bring parents to assume that there's something going on. And the question is, then parents should use the I words. I have noticed this, or you seem sad to me. Do you want to talk about it? And again, teenagers often will rebuff attempts to talk about things because they go, I can handle this on my own. And that's the time when parents should say, look, I think it's appropriate that perhaps we go to talk to our trusted provider about this. Parents would not let a youngster limp for a week or two before asking what's going on. So physical things aside, they should notice those things, but listen more than talk, and then be supportive and say, I know you're going through some tough times, but we can get through this together.
It's about being present with your kid, too. Knowing, in order to spot those signs, you've got to be present with your kid. You have to know them, you have to be involved in their life, right? So someone said to me one time, all you need is one good person to make sure that they're there, that they're never going to leave. Important to just be there as a parent, right? So hard to be easy to be distracted.
Support and love are the two mainstays of parenting. Also patience and persistence, I might add.
Patience.
But the idea is that you're there for your child. Every parent is their child's champion. And so championing their feelings here and knowing that they're in pain. But again, they don't know how to get out of it. So again, this universal recommendation by the American Academy of Pediatrics to go for this kind of screening every time will bring up these ideas to the pediatricians, which pediatricians, I might add, are short on training and time.
Time.
So this is difficult for everybody involved. It's a challenge.
Yeah, for sure. Dr. Don Schifrin, thank you so much for your insight. We always love having you here in the studio.
Great to be with you.
So important, so important. All right, thank you, Doc.